Okay, welcome back to Med School Radio, where we bring you the best of music and of medical cases. So let's continue on. We're talking about the cardiovascular system, and we're going to look at case number 7 from the first aid series. A 2-week-old baby boy is seen in the pediatrician's office for a well baby checkup. On physical examination, the baby's femoral pulses are weak and delayed bilaterally. What is the most likely diagnosis? Coarctation of the aorta occurs 2 to 5 times more often in males than in females. In this condition, which part of the aorta is typically affected? In the majority of cases, the lesion is in the descending aorta, distal to the origin of the left subclavian artery, and in the periductal region. Disease course depends on the degree of obstruction after ductal closure, the presence of collateral circulation, and any associated cardiac anomalies. Less severe forms are characterized by an isolated aortic narrowing and the presence of adequate collateral flow. These forms progress gradually and become symptomatic between the 2nd and 3rd decades of life. Severe symptomatic disease in early infancy, less than 10 days of age, occurs if the coarctation is associated with additional cardiac anomalies and or inadequate collateral flow to compensate for ductal closure. So what is the characteristic finding on physical examination? Auscultation over the chest and or back may reveal a mid-systolic ejection murmur. A continuous murmur over the chest may also be heard in older individuals who have developed collateral circulation. Weak, delayed pulses in the lower extremities are also characteristic of coarctation. What chromosomal abnormalities are associated with this condition? Coarctation of the aorta is associated with Turner syndrome, which is 45XO. What findings on physical examination, ECG, and X-ray of the chest often develop over time in patients with this condition? Many patients develop hypertension of the upper extremities with weak, delayed femoral pulses. If the coarctation is proximal to the point of division of the left subclavian artery, the systolic pressure in the right arm may be greater than that in both the lower extremities and the left arm. Left ventricular hypertrophy is a common finding on ECG. X-ray of the chest often shows an indented aorta and or notching of the inferior surface of the ribs, usually around 7 years of age. This notching is the result of increased blood flow through the intrathoracic and intercostal vessels, which serve as collateral circulation. So that was a very good case number 7. So let's continue learning together. Try to remember the main points of this case, and we will see you next time.